Hello, everybody. My name is Yelena Kolosova, and this is my poster presentation for class 445. I am doing my um, audio on the interventions that I did, preventive strategies for communicable diseases and safety in immigrant populations. And I do apologize for my voice. I'm fighting off a flu here. So we'll just start with the introduction. Immigrant parents face unique set of psychological challenges when they're raising children in unfamiliar society, such as role reversals between parents and their children. And this reversal is due to various risk factors, such as language barriers, pardon me, unfamiliarity with the dominant culture, economic stressors, and also lack of social support. And in order for parents to maintain their dominant role in the family and become more culturalized to the new society, they must be more educated about issues concerning their children. Um, um, I'm sorry. So some of the background as far as why I chose this particular population. Um, Immigrant population has been increasing over the last 3 decades, and in the 1980s we see that it was 14.1 million, and then in 2010 we were up to 40.0 million. And then also there's a problem with um, speaking English. And in 2012, 85% of foreign-born population in the United States, ages 5 and older, spoke language other than English at home. And all of this data just kind of contributes to the immigrant population as the vulnerable population, because they also have low socioeconomic status, of course their immigration status there, and not speaking English and not really having any social support outside of the home. Some of the Healthy People 2020 objectives that I was covering with my health promotion interventions were to reduce, eliminate, and maintain elimination of cases of vaccine preventable diseases. And my goal was to increase the routine immunization rates and reduce preventable infectious diseases. And then another objective that I covered was the reduction of adolescent, which is ages 10 to 18, and young adult perpetration of and victimization of by crimes. And the goal there was to improve their health, their safety, and then their well-being. I apologize. So when I was doing an assessment, my population that I focused was the local daycare, and there I assessed the children. There was 14 total. Ages varied from 8 months to 12 years, and also their parents. Some of the sources that I used were just on-site assessment, questionnaires that I distributed to the parents, and I also looked at different peer-reviewed journals and public records to help me put my information together. Strategy, I assessed parental learning needs, and was done verbally and through a questionnaire as well. And I also interviewed the daycare workers. And basically what I came up with, there was a few common concerns or issues that were related to childhood health promotion and safety that the parents weren't aware of. So that's when I decided to do my intervention based on that. The theoretical framework that I used was a bioecological systems theory. And I really like this theory because it's very useful in the community setting. Because as we know, like families are or communities, they are influenced by a lot of different things. And this particular theory breaks everything down into systems. And the way this works is the interactions are bidirectionals, meaning like the family is influenced by the outside system, and then also the family can affect the system. For example, we have the microsystem, which is the family unit, the neighborhood, schools, public health system. Then we have the mesosystem, which where the family interacts, but not on a daily basis. We're talking like maybe like a home health nurse, a social worker. Then there's the exosystem, which is just the external environment influencing the family, like the welfare, school board, so on. Macro system is more broad, it's just cultural values, beliefs, attitudes. And chronosystem just changes that influence the family over time. Some of the barriers that I encountered as I was working with this population and also teaching them is they have a different cultural values. Like I don't know if I mentioned before, but um, excuse me, this particular daycare kind of catered to Russian-speaking parents because the daycare providers were also Russian-speaking, and these parents were getting like a subsidy from the government to pay for this, so that way the parents can attend local community college and learn English. So they definitely had like their own culture there. Also, you know, like English was a second language, or sometimes they didn't speak English at all. Their social and economic status was a barrier. Undermining from the children. We're talking, these were the children that were 10, 12 years old, where they grew up pretty much in the States and they spoke English better than their parents. And there was this undermining going on, kind of like the roles were reversed, and the parents were actually counting on the children, or almost like using them for like interpreting services. And that kind of gave the children a power over their parents. It was interesting to watch. And also not compliance. Some of the positive assets, the parents really did want to learn. They wanted to learn about these different health promotions. They wanted to learn how to become more encultured into the mainstream society, so they don't feel as outsiders, so they can feel comfortable with their children, you know. They also had a lot of familial support. Skills needed were the speaking and writing of English, and then the resources. Sometimes interpreting services, educational interventions, and like information in their native language, and support from school system. I also looked at a few research articles that pertain to this population and kind of different barriers that they have in order to, um, really follow through with the health promotion teaching. And there was a research by Kowal, Jardine, and Bubala, which show that most of the immigrant mothers, I'm assuming fathers too, are pretty passive when it comes to making decisions about their children's health. And in this particular study, they were talking about vaccinations, and that stems from the parents not having enough information. So this just shows that like they are not very well informed. Another study done by Osnobishin and Kuman showed that immigrant families face that, the parent-child dynamic that is reversed when the children speak English and the parents don't, and then the children are more like enculturalized and the parents are still kind of struggling. So they have also those barriers. And also an article by Zhu and Perry just stress that when promoting health promotion or teaching health promotion in immigrant communities, you really do have to be aware that there's other kind of like difficulties to overcome. Besides the language barrier, there's the socioeconomic barrier, there's the health literacy, things like that. So some of my interventions, pardon me, that I taught to parents specifically were the prevention strategies for communicable diseases, such as immunization, and that routine immunization prevents disease. Lately, we've been hearing a lot on the news, and just different parents speaking their mind about how vaccinations are not safe and they can cause autism. And this, when families choose not to vaccinate, this really affects the community, especially if there's like an outbreak of a disease that was vaccine preventable. So I just did some teaching about the seriousness of vaccine preventable diseases, and I developed like an immunization chart that they can use, and so they can track their child's immunizations. The hand hygiene, I mostly taught that to the kids. I had a lot of fun because I incorporated that into different games. I used like the glow stick and like the glow germ, and they had a lot of fun just like singing their ABCs and washing their hands. So that's just to give them a more active role in their health, in their own health. And then I also taught strategies for internet and neighborhood safety. And this was specifically requested by the parents. They wanted to know more about the internet safety. Like I mentioned before, some of their older kids, had to do different projects for school, and they were on the internet, and the parents, some of them realized that the kids were taking advantage of them and like visiting different websites and chatting and so on and so forth without the parental permission. So I did some teaching about how they can do like parental control setup, or use different software that's also free to use, and then just like appropriate child safe search engines for their children, so they can be more like hands-on parents and protect their kids. And I also did a little teaching on community and neighborhood safety. Parents wanted to know how they find out whether there's any sex offenders in their area, and I provided them with a really neat website where they can go and just put in their zip code, and that will bring everybody who's like a registered sex offender or other predator. I mean, it's very user friendly to use. As far as budget, this took a lot of time. This was very time consuming. And so to hire a public nurse to do this, go to daycares and assess like parental knowledge or any concerns that they have, or provide any teachings, it's going to be very expensive. I mean, it costs close to $90,000 a year. And just seeing how the economy is right now, I just don't see it implemented anytime soon. My goals for this particular project were to identify health promotion for selected population, create educational strategies, and provide population-specific teaching to address those strategies, and then identify community resources to meet proposed needs. Some of the needs were, like I said, they lacked information, especially in like Russian language. So I was able to find some online things, and also when I was doing my presentation, I was doing it also in Russian to whoever had any questions, since I'm fluent in Russian. So it was very, they really appreciated that, being able to ask questions and in their native tongue. And to measure my outcomes, basically I perform pre and post surveys. to just evaluate the effectiveness of my teaching and to see whether the parents really grasp the idea of what I taught, and just clear up any concerns. In conclusion, I would say there's an increased need for health promotion teaching within the immigrant population. And I only looked at the Russian population. I'm sure if you go into any other community where, you know, parents don't speak English, they do really need that educational health promotion, you know, teaching. And I would have to say more resources and staff are needed to address this, the various barriers that these particular populations are facing. Thank you so much for you know, listening to me present this poster, and I hope you learned something. Thank you.